This video will discuss the relationship between blood pressure and shock.
What is blood pressure? Blood pressure is the pressure of the blood that circulates all over the body in the walls of the vessels. When our heart beats, the blood pumps around our body so that it can provide oxygen. The blood moves against the sides of the vessels. The strength of pushing is known as blood pressure. Types of blood pressure and its normal ranges. The first one is systolic when the heart is in contraction. The another one is diastolic when the heart is at rest. Normal range is 120 over 80 mmHg. Blood pressure is always measured in millimeters of mercury, which is mmHg.
Factors affecting blood pressure. There are three main factors affecting blood pressure: peripheral resistance, cardiac output, and blood volume. Peripheral resistance, the resistance of the arteries to blood flow. As the arteries constrict, the resistance increases, and as they dilate, resistance decreases. It can be affected by autonomic activity, pharmacologic agents, and blood viscosity. Cardiac output, the measurement of blood flow from the heart through the ventricles. As cardiac output increases, blood pressure will elevate, promoting blood flow, and as cardiac output decreases, blood pressure and flow will decrease. It can be affected by heart rate and stroke volume. Blood volume, the total quantity of blood in the body. As the volume increases, the blood pressure and flow are elevated, and as volume decreases, blood pressure and flow will decrease also. It can be affected by cardiac output and blood velocity.
What is shock? Shock is an acute medical condition associated with a fall in blood pressure caused by such events as loss of blood, severe burns, allergic reaction, or sudden emotional stress. Shock is a life-threatening critical illness or injury which requires a quick assessment and treatment. Shock means the patient has inadequate tissue perfusion, which leads to insufficient delivery of oxygen and required nutrients to meet the needs of the tissue.
So, how blood pressure relates to shock? Hypotension defined as systolic blood pressure less than 90 milliliters of mercury or less than 60 milliliters of mercury in diastolic blood pressure. Although hypotension is not necessary for the diagnosis of shock, it is one of the most important signs which indicates shock. Excessive low blood pressure can result in insufficient blood flow, which causes inadequate delivery of oxygen to meet the needs of the tissue. Diagnosis of shock depends on combination of key historical features and physical findings. However, shock can be suspected when systolic blood pressure is under 90 mm of mercury or mean arterial blood pressure is under 65 mm of mercury.
Now, let's talk about the different types of shock. Hypothalamic shock is the low circulation of the blood flow, which occurs through injury or accident trauma. Cardiogenic shock is typically caused by myocardial infarction, in other words, known as heart attack. Obstructive shock is a life-threatening condition that occurs when there's a problem with the functioning of the heart. Anaphylactic shock is a serious life-threatening allergic reaction. The most common anaphylactic reactions are food, insect stings, and medication. Septic shock is a serious condition that occurs when a body-wide infection leads to dangerously low blood pressure. Neurogenic shock occurs after damage to the pathway of the central nervous system, particularly when the spinal cord is damaged.